Hi, I want to thank everybody for attending this webinar tonight. And tonight we're talking about the buzzword functional medicine. I'm sure you've heard it in the news, maybe even seen it on TV shows like Dr. Oz. So tonight we're going to really kind of get into what this means. And to me, it's really simple. It really is just the right way to practice medicine. It's a common sense approach. So we're going to look at the tenets of holistic and functional medicine, the paradigms that exist within them. We're going to look at some really neat advances in diagnostics and then put everything together, right? So, how can we use these tenets in a practical way for treatment and treatment that works? So, if we look at some of the functional medicine tenets, it's patient centered. It is also an establishment between the doctor and a patient partnership. In other words, we don't want to walk into the doctor's office, hand over our responsibility, hand over our autonomy, and then have a dictator, the M deity, tell us what to do. Here, take this magic pill or take this magic potion. A partnership is different. We walk into the doctor's office, and the doctor is creating a partnership in the sense that he's handing autonomy back over to the patient. He is handing responsibility back over to the patient, and he is there as a guide. And with chronic illness, this is a must because we know that diet and lifestyle play such a critical role. We want a systems approach, and a systems approach is basically stop looking at our health in a silo of just one organ system. We want to look at the body as an integrated whole. We want to look at the complete life cycle of a patient. So did something happen in utero or post utero in childhood development, adolescent development? So we don't want to just look at the person as a stagnant, static being presenting at that moment. We want to look at the development over time that possibly has led to some of the signs and symptoms that they are now presenting with. It's the science of diagnosing and treating function, which is really just another way of treating the cause rather than the symptom. It's lifestyle medicine, and all that means is that we want to focus on diet and lifestyle as the core element or fundamental change. We want to walk up the ladder of more invasive treatments only when we've extinguished and used the non-invasive lifestyle measures first. It's an integrated and a holistic approach. Prevention is paramount, right? Because it is so much easier to prevent than to treat chronic illness. And so once we get somebody out of pain or out of the signs and symptoms that they're currently expressing, we want to keep it there, right? We want to prevent these things from happening. And then we want to take this all a step further because our physical health really is a vehicle, right, for our spiritual development. Meaning, it's about self-actualization. It's about becoming the best version of ourselves on all dimensions, on the physical plane, the mental, and the spiritual plane. And then it also includes, so that is an ascending movement, right, of bettering ourselves. And then we have something which is called self-transcendence. And this is not about restoring or going back to a prior condition before the symptoms, meaning we're not wanting to just get rid of the symptoms and return somebody back to where they were, right? This is about moving towards a new reality, a new future. This is about self-transcending oneself to a new level of health. In fact, the power that made the body can heal the body. And self-transcendence is also, as we self-actualize and we ascend, self-transcendence is about taking this boon, this gift that we received, and then bringing it to the world. So one of the tenets is patient-centered, right? Along with the partnership, as we talked about. And in this cartoon, we have the doctor coming in and saying, how's the appendix in bed 3? And the nurse says, I don't know about the appendix, but the person is doing fine. And the patient says, thanks, I like to be respected for being me. the idea here, or the point, is simply that it does have to be patient-centered, because all diseases manifest differently. We want to treat the patient with the disease per se, rather than treat the disease. Simply because we can have 10 people all diagnosed with depression for 10 different reasons. There could be the neuroinflammation model that's attacking the brain. There could be situational depression and emotional distress. There could be gut challenges, as we know that there's a link between the gut and the brain. And so if we don't have an individualized approach, right, a patient-centered approach, then we're going to be missing some of the key ingredients for helping with healing and treatment. We don't want just a treatment plan that is like a cookie cutter approach. A systems approach is really understanding that the whole body is connected. You can't treat one system and ignore the whole. So, right, we got the circulatory system, that's going to be dealt by the cardiovascular, the nervous system by the neurologist, and so forth. And so we have all these specialties, which are great, because conventional medicine is awesome if there is an acute illness or injury and we really need a specialist in these particular fields. But they stink, for treatment of chronic degenerative diseases, because we have patients going to one doctor for one medication, and then another doctor for another medication, and then another doctor for another medication, and none of them are communicating. And we can have something as simple as somebody dealing with gastrointestinal issues, and they have an inflamed colon. They go to the GI, and the GI doctor treats them in one way. Then they're dealing with depression. They're going to a therapist to treat the depression. But the whole thing is, we don't want an organocentric view, meaning a silo where we're looking at the lens that we're using, or a doctor is using. It's looking that their system is in isolation of all the other systems. Most of the time when somebody's coming in, they think they have thousands of problems or thousands of symptoms, but they're all tied in. You can, as an example, have somebody with gastrointestinal distress, somebody who's dealing with an autoimmune related issue, who has an infectious disease. Those are all related. It's called the triad of autoimmunity. And so that person would be going to a gastroenterologist, would be going to a neurologist, would be going to an infectious disease specialist, which is not appropriate because they'll never actually treat the underlying condition. And by not taking a systems approach, we fall into this problem. So this next section is vital in the sense that we have to understand this concept in order for us to be able to integrate the appropriate treatment. So we need a new paradigm, because the paradigm that we currently have is just not working. So we have a new health equation, and it states nature plus nurture equals mediators, signs and symptoms, and diagnoses. So if we break it down, nature is our inheritable factors like our DNA. And how that DNA bathes in the environment, diet, and lifestyle will produce mediators, some that we can detect and some that we can't. This could be physiological damage like oxidative stress, free radicals, high cholesterol, high sugar, and the effect that it has on the different body systems like the gastrointestinal system or the cardiac system, etc. They produce signs and symptoms: chest pain, musculoskeletal pain, fatigue, and then ultimately we get a diagnosis, which would be something like autoimmunity. So if we look at perhaps an analogy, we can use a match being struck, which creates a fire, and then it creates the smoke. So if we look at the cause is really the match. So this would be nature and nurture, right? The genetics bathing in the environment would produce certain mediators, fire, the physiological damage in the body systems, which ultimately will leave a trail of smoke, which are the signs and symptoms and the diagnoses. Nature, if we look at it, is really this book of life that everybody talks about, the genetics. And the old idea was that we were given a book, right, at the time of conception, and we are now locked into this book for the rest of our life. We don't really have a lot of flexibility. If it says that there's a chapter 23 on autoimmunity, you're going to get autoimmunity. And we now know that to be false, because whether or not a chapter is read, whether or not a page is blurred or it's jagged or it gets ripped out, what health chapters are read all depends upon the environment that the book is actually being bathed in. So in other words, we can even think of it, we have a piano, which represents the genes. How the piano is played, the piano player, is really the environment, the epigenetics, which we'll talk about in a minute, that's influencing on what is going to be expressed or what's going to be read in the book or what's going to be played on the piano. Nurture, right, is the hands of the piano player. It's the sum total of all the non-genetic environmental factors. The interesting thing here is I think that in general, science has made a couple errors. The first is that there's been a real big limitation to these environmental factors as being limited primarily to physical influences. And then also they've limited it to really the time during conception. So we want to break these two ideas. We want to extend the time period from preconception, meaning before conception, peri, which is around, so the status of mom and dad around the time of conception, conception itself, in utero, and then post utero, childhood, adolescence, and adulthood. And this is really practical in the sense that, obviously in utero, how the baby was developing and the status of mom at the time is extremely important. Was she smoking? Was she drinking? And so forth. Periconception is extremely important as well because, dad contributes 50% of the genetics. And so what was the status of dad at the time? And then, post utero is really important, so whether or not somebody, as an example, why this would be important. If somebody was born a C-section as compared to a live birth, makes a big difference. The literature shows that obviously if you're having a live birth, the baby comes out and it comes into contact with a small amount of fecal material from mom and it gets re-inoculated, or their bowels get re-inoculated for the rest of their lives with a certain type of bacteria. But when you're in a C-section, that doesn't happen. And so what they see is that it's more likely for people who are born of a C-section to have gastrointestinal related problems or issues. And then, of course, we don't want to limit it to just the physical influences. We want to extend it, past into the emotional, the spiritual realms, and so forth. So if we break down nurture, it really can be broken down into three parts, what is called epigenetics, metagenetics, and transgenetics. And epigenetics is really physical and non-physical factors that interplay with the physical factors of the body, like the DNA, right? So these are the physical structures. So this would be like diet and lifestyle, whether or not the person's had surgeries in the past, the medications that they're taking, toxins that they've been exposed to, air and sunshine, exercise, etc., all the things that we would typically think about. And yes, the scientific community, does, in some ways regard non-physical factors as having some interplay into how a person develops, but really the emphasis is mostly on these physical attributes. So metagenetics is really a term proposed, and meta means beyond, so it's beyond genetics. So epigenetics was above the gene, so the hands of the piano player playing on the piano. Metagenetics goes even a step further, right? So this is the non-physical factors that interplay with the non-physical factors of the body. So memes archetypes, cultural indoctrination, something called morphogenic fields and miasms. These are all non-tangible elements that exist, that actually interplay with how our body is responding. So memes are these units of cultural inheritance. Just like a gene is a unit of DNA or physical inheritance, a meme is a unit of cultural inheritance. So as an example, ones that we always use here is, in the United States, a meme is that we eat cows. It's okay to eat a cow. And then say in India, they revere the cow, right? It's just a meme. Archetypes, they're the archetypal patterns that Carl Jung talked about, the caregiver archetype, and all the different archetypes that influence us, cultural indoctrination, and so forth. Transgenetics, we're not really going to be talking about too much right now, but this is really transcending. So these are spiritual factors that interplay with the non-physical aspects of the body. So this could be everything from your religious beliefs to karma, cycles of death and rebirth like samsara. They have to be included, right? We need to look at the entire life cycle. We need to look at the influence of the physical and the non-physical as well on a human person. Then we come to the fire, right? So we are nature, nurture, then produce fire. So these are cellular distress like sugar, oxygen, oxidative stress, inflammation, and then their effect on the different body systems like the gastrointestinal system, the communication systems of the body, and the detox. And with functional medicine, these are the really big ones that we target. Sugar, of course, is related to diabetes. We need to be using our sugar appropriately. If we're not, we're going to create major distress in the body. We have to use our oxygen. Otherwise, we're going to be developing, hypoxia. We're going to be developing issues where our body is not being fed appropriately, energy problems, anemia. Oxidative stress is free radical damage that basically creates catabolism or breakdown of the human body. And then, of course, inflammation is linked to all the diseases that now plague man and womankind. So these are really key cellular mediators that we really need to be looking at. And then body systems, the big ones are really the gastrointestinal system, because if you don't have proper absorption, nothing in the human body is going to work. Every single thing is dependent upon absorption in the gastrointestinal tract. And that's why Ayurvedic medicine, 5,000 years ago, point to the gut as the seat of all health. So we want to make sure that the gastrointestinal tract is working appropriately, that there is no issues with malabsorption. We also want to make sure that there's no high levels of inflammation, because that's where the majority of the body's immune system is housed. So we want to really target the GI system. The communication systems, we're looking at the neuroendocrine model, meaning how the nervous system is responding. We're looking at the hormonal systems, the neurotransmitters. We're looking at how the body is communicating. And in essence, we want the body to be communicating in a coherent pattern rather than an incoherent pattern. And then detoxification systems, right? These are the involvement of all the organs of elimination, like the liver and the kidney and the skin and the lungs and so forth. We want to make sure that we are being able to get rid of the toxins that we're being exposed to on a regular basis. So these are the big areas that the fundamentals that we want to focus in on first. So functional medicine, breaks it down into core imbalances or mediators. So this is really what lies before the actual symptom. And they have it broken down into assimilation and elimination and so forth that you can see right here. Then eventually, as we're building on this equation, then we get to the smoke, right? The signs and symptoms: fatigue and weight gain, weight loss, loss of libido, sleep disturbance, etc. And then finally, we get the name diagnoses like diabetes and autoimmunity and depression and cancer and so forth. So let's put it all together, right? We have a new health equation. We have the match, which is the cause. Nature or genetics, dancing with nurture, which is really, we can think of, say, as diet and lifestyle, produces things that we can test in, say, blood work or urine testing or saliva. And these are the mediators. These are the issues like the high cholesterol, hemoglobin A1C, all the things that we can look at in a laboratory test, which ultimately lead to the smoke, which are the signs and symptoms and the diagnosis. So when we look at that health equation, we have to ask ourselves, right, where does conventional medicine really look? And if we were to kind of isolate it, on this kind of continuum here, they're really focusing on the bottom, right? The signs and the symptoms and the diagnosis. They look at the mediators, but they look at them through a lens or the silo of organocentric view, meaning everything is in isolation from one another. So they're dabbling in the fire, right? But they're actually not looking at it contextually as a whole unit, and that's really where we're wanting to look at. Then the question really becomes, right? Do we actually need to know the name diagnosis? And of course we do. It's helpful. However, from a functional medicine perspective, right, because it's so far down on the chain, what's really more important is to identify causes, is to identify the mediators, because ultimately that's what we're going to be treating. We're not going to be treating, as an example, depression. We don't treat a diagnosis of depression. We don't treat a diagnosis of heart disease. We're actually trying to figure out what is causing, right, these myriad of symptoms that we can actually put into a category of a diagnosis. As we said before, 10 people can have depression for 10 different reasons. People can have cardiovascular disease for 10 different reasons as well. One can be a smoker. One could be eating lots of fried food. One could be not exercising, or it could be a combination of all three. So now we want to put this all together in a summary, right? First, our health is not predetermined by our genes, right? The piano player is really the one who's determining what's being played on the piano. And this would be the episome. These are the physical and the non-physical factors, the epigenetics, the meta, and the transgenetics. Chronic illness is a result of imbalances in those mediators, right? So inflammation, oxidative stress, glucose control, the body systems, the gastrointestinal system, the communication systems, and so forth. The absence of disease does not necessarily equate to the presence of wellness. Each person is unique and treatment should be individualized. And drugs are just not effective for lifestyle type diseases. So we move on. And what we want to now look at is, why should we use what is referred to as functional testing? So on the top, we have the x-axis, which is time, and y is disease severity. And the conventional mindset is binary. It's black and white. You're normal, and then all of a sudden you wake up one day and you're diseased. It's just out of the blue. On the bottom, from a functional perspective, right, you have optimal levels, but then there's these shades of gray in between, right, where functional testing shines and it can pick them up before you get the disease, right? So autoimmunity is a great example. You have somebody who's just not feeling well, and they keep running autoimmune testing. It's normal, it's normal, it's normal, 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 normal. And we know autoimmunity doesn't really, shine or poke its ugly face out until, sometimes the third, fourth, or even fifth decade of life. And so one day they run an autoimmune panel and they tell the patient now they have autoimmunity, and it's a complete shock. It's a surprise, even though they had a family history, say, of autoimmunity, and they have thyroid-related issues. It's because those tests aren't sensitive enough, right, to pick up the shades of gray in between. When they're picking it up in the blood work, it's too late. Now you already have kind of a downstream issue where the body's been being attacked for such a long time. I'd like to use this analogy, right? Conventional testing is like a picture. So give you an example, right? Let's say that two people got married and they get in the plane, they go to their destination, honeymoon, and they ask somebody to take a picture of them on the beach, and we see the picture on the left. However, What we don't know is that during the plane ride to get to their destination, they were fighting the entire time and ready to get a divorce. When we look at conventional testing, it's taking a picture. We have depression as an example. Let's take a brain MRI. It's a static, and we look at to see if there's pathology, a tumor, and so forth. We have gastrointestinal related issues, and we go get an endoscopy or we get a colonoscopy. We're looking for a bleed. We're looking for a polyp. But the problem that we're seeing today, right, for most of chronic illnesses in patients is that the conventional testing of taking pictures in a static way doesn't help because we can't see depression on a brain MRI. We have to do more advanced testing. When somebody has gastrointestinal upset and they have food sensitivities, and you do an endoscopy and a colonoscopy and everything is normal, and you tell the patient that everything is fine, then they're left to think that it's all in their head. And so we need to have other ways of testing this. And so the functional testing really looks at the mediators, and the conventional testing is really looking at the symptoms. So new diagnostic paradigm, right? You go to the doctor's office again, and they tell you that everything is normal. However, you still feel sick. And that's primarily because we need new ranges, right? We need these functional lab ranges, right, to kind of help us in determining ahead of time whether or not something is going to develop. So we could take the same blood work that your conventional medicine doctor uses. However, we can read it completely different with new established functional lab ranges to pick up hidden issues in just a normal regular blood work, not even using the functional testing at this point, but just looking at the normal blood work that you've had. We can actually use new established reference ranges, which are called functional ranges, to kind of pick up hidden discrepancies when the doctor is basically saying that everything looks normal and of course you're not feeling normal. So just to give, an example here, let's take glucose. Glucose is, blood sugar, and it should be around 60 to 100. So January 3rd, 2009, the patient went to the doctor's office and their blood glucose measured at 82. The next year, on March 6, 2010, they went to the doctor's office and it measured 88. In May of 2011, they saw another doctor who did not look at the previous blood parameters that they had in 2010 and 2009, and it fit the criteria, 94. And then the following year, it was 98, but it still was in the normal range, 60 to 100. And they also sent the patient home because they didn't look at the previous blood works from prior. And then they go into the lab or the doctor's office and they are surprised to learn that they have diabetes. When you look at blood work, the most important thing is not only to compare yourself to reference ranges and functional ranges that are established, but is actually to compare yourself to yourself, right? So you're wanting to look at the delta or change over time, because that really is where you can find some hidden value in looking. So for example, in this patient, if you looked at the trajectory, right, over time, you can see that this particular marker is increasing, right? So there's something going on with that person's body. This is an individual approach, and this could have been spotted, right, a longer time, or the discussion could have come up a long time prior to tell the person that they're kind of moving in that direction. When we look at, cardiovascular, which is another great example of the old paradigm of treatment as compared to the new paradigm, we can see that the old paradigm is really just based on this cholesterol model, right? If your cholesterol is elevated, then there is a correlation with cardiovascular disease. And what we want to do is screen somebody for cholesterol. And if they have high cholesterol, we put them on a statin medication to decrease or lower their cholesterol. And that's about it, right? Maybe we'll kind of look at their, their weight and whether or not they're smoking as some of the more common factors that interplay with cardiovascular disease. But in essence, that's how we look at it. So we now know that, sometimes when people go to the cardiologist and they can get a clean bill of health, and then on Monday morning, which is where most heart attacks occur, they wake up and they have a heart attack. So we know that there's other factors that are playing on that. And so when we look from a functional medicine perspective, right, we're opening the door. We're opening the door on kind of this multi-dimensional approach to cardiovascular disease. And there's so many factors that have been identified. Omega-3 fatty acid status, our insulin levels, sugar, we know, affects the cardiovascular system. So there's a correlation between blood sugar dysregulation and diabetes and cardiovascular disease. Low vitamin D levels have been associated with cardiovascular disease. A marker called homocysteine. If you're a man and you have low testosterone, that is also linked to cardiovascular disease. High estrogen, or what they refer to as estrogen dominance, inflammation, and so forth. And so we want to, as an example with a cardio patient, put all of these factors together out on the table, because this is really what gives us a hint or an idea into the workings on whether or not that person is having problems with the cardiovascular system. So to look at an example, right, of how conventional medicine is, say, treating cardiovascular disease, we can look at one of the biggest myths that currently plague us today, because cardiovascular disease is the #1 killer in the United States. So we have to understand first where cholesterol comes from and saturated fat comes from. So cholesterol is only found in animal products, period. It's not found in fruit, vegetables, grains, beans, nuts, or seeds. Saturated fat is primarily only found in animal products, with 2 exceptions in the plant world, and that is palm and coconut oil. And in fact, the palm and coconut have a different type of fatty acid structure. They're called medium chain fatty acids, which are in essence cardioprotective, whereby the saturated fats that are found in animal flesh are actually deleterious or disease promoting. Okay, with that understanding, right, we go to the doctor and we are told that we have high or elevated levels of cholesterol. And what we are told to do is to trade a piece of chicken for a piece of red meat, add more fish into our diet. But if you were to, open up a nutritional book or even ask Dr. Google, you're going to find that a typical serving of chicken is about 85 milligrams of cholesterol, and a piece of red meat, 86 milligrams of cholesterol. No doubt that the saturated fat content is different in both. The chicken wears its saturated fat external, and where the red meat, it's marbled in. And so there is a decrease in the saturated fat in a piece of chicken and red meat, but there's no really big difference at all in the cholesterol content. And then fish has more cholesterol than both of them. We're missing the point. As Americans, we're eating around 300 pounds of animal flesh, whether it's in the form of organic or non-organic, turkey, chicken, fish, eggs, as well as secretions. Again, these are, dairy, milk and cheese and so forth. That's the issue. And the issue isn't exchanging one type for another, even if it is organic. The issue is that we're eating too much of it. We're being gluttonous with the amount of processed foods that we're eating, and we're being gluttonous in the amount of animal flesh and secretion that we're eating. The goal, the nutritional tenet, is that we're needing to add more plant-based materials into our diet. And so that's why we have this epidemic today of cardiovascular disease, because the entire structure has been based on a faulty premise. Okay, so this is a real hot topic. This is, the treatment of hormone. And we do have another webinar that is more detailed about a hormone treatment, but we'll just kind of briefly go over a few things here. So there's a difference between, the functional medicine approach to hormone treatment versus the traditional or the replacement model. To me, you don't need a medical degree to do the traditional or the replacement model. A 50-year-old male walks into a doctor's office and blood test shows that they have low testosterone. You give them testosterone. A woman walks into her gynecologist and blood work is done and it shows she has low progesterone. She is given progesterone. It's as simple as that. It's a replacement model. Whatever you find, you just replace back. And there's two ways that you can replace it. You can do it, 50-year-old male who walks in with that low testosterone. You can do it age appropriate for 50 years old. Or you can do a youth aspiring, which is kind of anti-aging. Let's give you testosterone levels that actually are similar to that of a reference range of somebody in their 30s. Unfortunately, this leads to what is referred to as tissue saturation, because the person who is getting the hormone, right, the hormone replacement, it's signaling their body that they no longer need to produce hormones anymore. And once that happens, it actually makes their condition even that much worse, because now they become incarcerated for the rest of their life on HRT, which is hormone replacement therapy. The functional approach is a little different. We're wanting to restore the body's ability to regulate its own production of hormones. So in the case of that man and that woman, the goal is, and the question that we're asking is, number one, why is it low? Why is the testosterone low? Why is their progesterone low? And then how can we stimulate their body to produce the correct amount of hormones? So let's just give it, an example here. We'll again talk about that 50-year-old male who walks into the doctor's office and he complains of say fatigue. He's overweight and he has a loss of libido. And he's going to the doctor. He just doesn't know what's wrong. So the doctor runs a whole bunch of testing and he finds out that this particular man has low testosterone levels. One of the things that we know is that when you carry extra weight or adipose tissue, we know that the testosterone that the body produces will actually go into the fat tissue and it gets converted into estrogen. That's why as men gain more weight, they feminize, right? They actually grow breasts. The same thing happens, or kind of a different way, for women. A woman is going to take their estrogen, right, if they're overweight, and it's actually getting converted into testosterone. And that's why when women increase their weight, they masculinize and they can get facial hair and in certain areas of their face where they don't want it. So if we go back to this scenario, whether it's a man or a woman, right, walks into the doctor's office and they're overweight or obese, we know, right, that the first line intervention should be to tell that person that if they lose weight, and let's help you lose the weight, that your testosterone levels will naturally come back up to their normal levels. Otherwise, if we give them testosterone, we're basically perpetuating the same problem, and we're actually making it worse. Temporarily, they may feel better, but what it's actually doing even more is stopping their body from producing testosterone. Hashimoto's is another example of just endocrinology gone totally the wrong direction. Hashimoto's is an autoimmune disease that's targeted, the immune system targets the thyroid gland. And it is the number one cause of hypothyroidism in the United States. So it needs to be tested. And the reason why it needs to be tested is because it becomes whether or not you're treating a thyroid condition or you're treating an autoimmune condition. And that is vital as far as the success of that patient. Because what I see in the office is too many people with hypothyroid who are taking medication, but who feel like crap. They don't really have any changes in the way that they're feeling. The only thing that's happening is that their blood work is looking rather good. The thyroid system is complicated. And if you allow me to, just take a second to kind of explain this slide, the details are not important, but I just want to show the complexity. Your brain produces thyroid stimulating hormone, which talks to your thyroid gland. Your thyroid gland then produces two types of thyroid hormones called T4 and T3. T4 is inactive, T3 is active. A small percentage of T3 is made in the thyroid, the active form. The rest of the T4 goes to the liver to get converted into T3 and also goes to the gut to get converted into T3. So when we look at somebody with a thyroid issue, we need to get, first of all, a complete thyroid panel, and we need to see the other influences that are affecting the thyroid, which is not on this slide, but the adrenal glands actually, if they're not functioning properly, will cause inhibition of the conversion of T4 to T3. So here's the complexity for somebody with a thyroid. And this is true with all endocrine related issues, whether it's in the thyroid or sex hormones and so forth. Is the issue coming from signaling from the brain to the thyroid gland? Is the issue with the thyroid gland unable, because of nutrient stores, iodine and so forth, not able to make the thyroid hormone? Is the issue with conversion in the liver or conversion in the gut? Is there dysbiosis in the gut? Or is there other influences like the adrenal glands? And the point of this slide is to show you that there is no way to basically reduce a hypothyroid case into something as simple as, here, take Synthroid or Armour Thyroid, without looking at these other complex structures that may be affecting the person, for not just management, because that's not what we're looking for with functional medicine and holistic medicine. We're not looking to manage a patient. We're looking for a way to find a cure, a treatment that's actually going to work. Stress is one of the number one killers, in the United States, and it can lead, the adrenal glands sit on top of your kidneys, and they produce what is referred to as the stress hormone called cortisol. And it really is linked to everything from, obesity, central adiposity, where you basically put weight around the abdomen, depression, arthritic changes, immune issues, and it can create havoc with the sex hormones as well, and thyroid inhibition that we just talked about. Stress also has a connection with diabetes because of the sugar regulation that cortisol is involved in. Stress can actually influence the cardiovascular system. Adrenaline can actually increase the heart. You can get what's called non-cardiac symptoms, meaning that the heart is fine when you take a picture of it, but you're getting influences from cortisol in increasing the pulse rate and the blood pressure. So stress is an extremely important component to look at. And you really need to do what is referred to as functional testing, say, as an example, for stress. So these are, a couple labs here in our office. This is what is referred to as an adrenal stress index panel. The top one, you can see the rhythm of cortisol throughout the day. So if somebody, as an example on the upper right, they got their cortisol measured at 8 a.m. and if it's in the green, it's normal. At noon, you can see it's starting to come out. At 4 p.m., you can see it's completely elevated. And then it begins to go back down again. But here's the problem with conventional testing, because if that person, which typically people go get their blood work done in the morning, were to have their blood tested for cortisol in the morning, they would have never been able to see the pattern of the stress response that person is going through. And so from noon all the way until the time that they're sleeping is really where the heart of the issue is coming, right? This could be, a person at the end of the day of work coming home and the stress that's amounting, and it's basically affecting them for the rest of the day. So it's really, really important to dig deeper into some of these functional testings. Even if you suspect and your blood work is telling you that you're normal, that's where this comes in really handy to help figure out and to treat and to get you feeling better. So now we want to take all this information and figure out how do we practically utilize it. So the first thing is really we need to distinguish between controllable versus uncontrollable factors. And the things that we can control, we want to begin to attack immediately and work on. And the things that we can't control, we want to practice the art of surrender, right? This is the art of practicing the serenity prayer. So, as an example, let's say that somebody's dealing with a chronic illness who's living in a polluted city, say like New York or Manhattan, and it's just not available for them to move just yet out of the city into an area where they won't be exposed to as many toxins to burden their already compromised liver, as an example. So what they would do, right, is they're going to work on a strategizing way that to move if that is something that they desire to do, but they're going to surrender primarily because if they keep thinking about it, right? What you keep thinking about persists, and what you keep thinking about, what your body focuses in on, it becomes manifest. And so we don't want to create more stress. So you identify the things that you can't control, you surrender to it, and now you begin to work on those things that you can control. And within those controllable factors, right, these modifiable factors, we want to distinguish between what is primary and then what is secondary. So we then take it to the next logical conclusion, which is we want to work on primary concerns first and then secondary concerns second. I know it sounds simple. However, this is not what's utilized today. So as an example, we can have somebody who comes in with low libido, who's overweight, who's complaining of fatigue, who has food sensitivities, who's under an enormous amount of stress, both at home and at work. The relationship is failing. And their only concern is to get food sensitivity testing because they know that if they can find out what foods are causing them problems, it will really help with everything that they're dealing with. And although it's a partnership, right? And if it is something that they really want to do, of course, we will help to get the right testing that it is that they're wanting to do. But in that case scenario, it's extremely important that we work on the primary concerns first, the fundamentals. Because what we see with, like as an example, with food sensitivities, we could be testing an entire panel and it comes back that they have 50 food sensitivities, but that might just be testing their poor diet. The fact that their gut is under an enormous amount of inflammation, they have dysbiosis or overgrowth of bacteria. It's basically what they refer to as leaky gut, or they're having malabsorption related issues. They're under a lot of stress, so the immune system in the gut is not recognizing the foods as well as it should be. And there's so many other factors that if we dealt with first could minimize the food sensitivities. And the big thing is that we want to make sure that what we're testing is we're not testing somebody's poor dietary and lifestyle habits. When we do testing, we want to make sure that we're actually looking at the underlying conditions that are causing their problems rather than testing their poor diet and lifestyle. So what are the controllable factors? Well, it's of course diet. Diet plays a critical component. It's our lifestyle, like whether or not we're sedentary or exercising. It's the environment that we bathe ourselves in. So whether it's our home environment, the people that we're hanging out with, are they toxic? Our work environment. It's our perception, right? Is the lens that we're wearing one of a victim archetype, right? Where we've surrendered our health, where we surrendered our autonomy and things happen to us. Or are we wearing the perceptual lenses of the co-creative power that allows us to heal, right? That we're participating in our own healthcare. And then we want to look at those core mediators. Initially, we want to look at the core mediators that we've identified, like the oxygen and the sugar and the different body systems, before we go into more advanced mediators. So the treatment, step one. We want to work on those primary concerns. And we utilize a whole food, plant-based diet for so many reasons. Some of them include the fact that it is, in essence, an autoimmune diet. It is the lowest inflammatory load that you can put on the human body. It carries the least amount of toxicity. The higher you eat up on the food chain, The more toxicity your body has to deal with, more energy that's produced to break down those products. And we want to make sure that we're getting the least amount of toxicity into our system, and that requires us eating more fruits and vegetables. We want to make sure we're alkalizing our body. We want to make sure we're getting the nutrients that we need for healing. And we want to make sure that we're going on a what's referred to as a low glycemic load. So a whole food plant-based diet basically adheres to all those principles. We want to make sure we're concentrating on our lifestyle. What is our exercise pattern? What is our sleep hygiene? Are we practicing self-care, and are we wearing the correct lens? What's our stress, and are we taking active measures to reduce it? Do we practice prayer or breath work or whatever it is? But we need to be practicing some form of stress reduction technique that is individualized to you. We have to look at the environment, and then of course we have to look in the way that our genes are being bathed in those physical and those non-physical factors, which we refer to as the epigenetic, the metagenetic, and the transgenetic. Then, once we worked on those fundamentals, right, this is really where it becomes really then important for us to look deeper, if we're still persisting with the signs and symptoms, into those secondary concerns, right? This is where we obtain some of the really advanced functional medicine diagnostics and then address those mediators, those secondary mediators. So it's not that we won't sometimes jump right into step 2 with patients, right? Let's say that somebody came in and had already for years committed to dietary and lifestyle excellence, right? Of course, we want to dig deeper right at that point. But for the vast majority of people that we see, they need to be challenged immediately for a good period of 4 to 6 weeks on dietary and lifestyle excellence in an effort so we can test the true nature and cause rather than testing again their poor dietary and lifestyle habits. So the mediators, some of the ones that functional medicine looks at is they break it down into these areas, but assimilation and elimination, which is really the organs of elimination and the gastrointestinal tract, detox systems, defense, which would include inflammation and food sensitivities, biotoxins, or these are toxins that are alive like viruses and bacteria, the communication systems of the human body, hormones, the nervous system, the neurotransmitters that are produced. And we want to make sure that the communication system is in coherence. Transport of fats like lipids, for energy, sugar, nutrients for healing. We want to make sure we're getting the right amount of antioxidants from plants to combat the negative effects of oxidative or free radical stress on the body. We want to look at the energy production of the human body, especially in the mitochondria, where we burn glucose and we use oxygen to give us what's called ATP or energy. And then, of course, the structural components like the muscles and the ligaments and the bones. So because the gastrointestinal tract is one of the primary areas that we address, we take this concept, what in functional medicine is called the 4R program, and apply it really in a more broad or generic way. So we want to start with remove, and this is, of course, with the gut. This is elimination of all of the biotoxins and the yeast and the bacteria. But this is also about removing all of the negative influence on our diet and lifestyle. This is cleaning up our diet. This is cleaning up the toxicity of our environment and the people. And it's a broad stroke of removal. And then we want to go in there and we want to nurture ourselves with the right nutrients. We want to start repairing all of the organ systems that have been broken down and the tissues. So this includes, a big portion of it is the gut, primarily because if the gut's not working, then of course nothing else is going to work. So we really want to focus in on repair if there is inflammation in the gut to kind of quiet that down. We then want to maintain, right? We want to make sure that we preserve what we've accomplished. So in the gut, we want to re-inoculate it with the right type of bacteria, colonizing the good bacteria rather than the bad bacteria. And there's many ways that this can be done through food as well as through supplements. And then we want to begin the process of rebalancing. Again, getting all the right nutrients and making sure that the communication systems are in coherence, and especially, looking at the hormone systems and the stress patterns that are associated with adrenal fatigue and so forth. So If you have additional questions about our practice and how we can help you out, feel free to give us a call. Feel free to email us. And definitely our website has a lot more information and other free webinars that you can download or take a peek at. Thank you so much for tuning in and listening.